Doctor, in the treatments that you offer that we've talked about, the PRP, prolotherapy, stem cells, most people want to know what the cost is, compared to getting an anti-inflammatory or something like that. Is obviously it might be a safer option for them, but is it cost effective as well?
Right. So if you look at a lot of stuff we do has great insurance coverage, whether it's different types of injections, epidurals, pain injections. We do a lot of work with different nerves and nerve blocks and getting nerves to function more healthy again. Those are all covered by insurance. When it comes to the regenerative procedures like the prolotherapy, the PRP, and the stem cells, at this point they're not covered by insurance. It might be soon that the PRP could be covered. The PRP was actually covered very well for a few years. But on the orthopedic side of it, there was some lobbying going against it. They were doing less orthopedic surgeries. And so because they were doing less orthopedic surgeries, they didn't want the PRP to be covered. So there was some lobbying done that the PRP code got put onto the kind of non-covered code. So when it goes to that code, it stays there for 2 years. But if you look at all the recent evidence from 2010 to 2013, I gave a recent talk on PRP and where it is with the research, and the research was overwhelming. Even the newest 2013 studies are showing that this outperforms the cortisone shots, which are covered by insurance. It outperforms some of the lubricating shots, which are covered by insurance. So it's outperforming them. If you look at the cost between the two, for example, somebody comes in to do PRP on their knee. Our cost for the PRP in the knee is about $600, which we charge the patients. If that patient would come in to see me and have a cortisone shot, that shot would probably be about $600 to $700 going through their insurance, or if they have a copay, they may be responsible for the $600 to $700. If they came in to see me and got a lubricating shot, which is like Suparts or the chicken comb injection, we may have heard a little bit about. It's just a lubricating joint. We do a lot of those as well, but that's going to cost their insurance anywhere from $800 to $1,200 just for that one injection. So from a dollar for dollar perspective, you're getting a lot more with regenerative procedures. It's going to do more for you long run, and it's actually less expensive to have it done.
This might be a hard question to answer, but let's stick with the knee again. If I have a problem with the knee and I choose prolotherapy, is it one office visit? Is it, on average, I guess, if you can, is it once a week for a month? I mean, how often until you don't see anybody for a while?
Right. So you come in, you have moderate knee arthritis in your knee, or you have an ACL that's loose or a meniscal tear. So with prolotherapy, we're usually talking anywhere from 3 to 5 treatments, separated by about 4 to 6 weeks. Okay. With the PRP, because it's a little more powerful, it's usually going to be 2 or 3 treatments separated about 4 to 6 weeks. With the stem cell, because that's the most powerful of the procedures, that might be 1 round and then you're done. So each one gets a little more powerful as far as the levels of procedures.